Hi, Anastasia.
Hi.
Good to see you again. How are you?
You too. I'm good. How are you?
All good. My name is Dr. Lux, and I'll be doing your checkup today. So tell me what brings you in.
So I was on a ski trip a couple weeks ago in Colorado, and ever since then I've been having some issues with my skin.
Okay.
I was out in the cold for a little too long some of the days, and I didn't have gloves on. I usually do, but I didn't this time, and I noticed, I don't know if it's frostbite or something started happening in my hands and my face.
Okay. Yeah, I do see some redness. And you mentioned this happened 2 weeks ago.
Yes.
2 weeks ago. On your faces. And what are the sensations that you're feeling right now?
So my hands, my face, and my feet, they've been kind of numb since then.
Numbness.
Sometimes even when I touch my neck with my hands, I can't even feel the sensation. I've been noticing some redness on my hands and my face, especially after I get out of the shower. They've been very dry as well.
Okay. Other than numbness and redness, have you noticed any other tingling sensations or abnormal feelings or?
Yeah, mainly on my feet and my hands, sometimes on my face a little bit as well. And I've been having a headache as well since that.
Okay.
The last couple of days that I've been there.
So the headache started 2 weeks ago at the same time?
Yeah, the same time. It was when I noticed I was out in the cold for too long. It started at the same time.
On a scale of 1 to 10, how intense is the headache?
It's not too bad, maybe like a 4, but it just feels like it's never going away. It's almost always there. It's been very annoying.
Can you point to where in your?
It's mainly on the front of my head, but also my ears have been hurting, and the surrounding area behind my ears, around them, I've been in pain as well.
Are you ready to transform your workouts into an immersive entertainment experience? Meet the Yesoul G1MPlus, the ultimate alternative to PATDOWN that brings fun and efficiency to your workout routine. With the Yesoul G1MPlus, your cardio sessions become something to look forward to. Its 21.5-inch Full HD screen rotates 360, allowing you to bring the perfect viewing angle. Simply connect your device via cable to stream your favorite content, be it YouTube workouts, TV shows, music video, ASMR videos, making each ride enjoyable and engaging. Experience high-quality audio with the bike's built-in dual speakers. The rich, immersive sound enhances your workouts, keeping you motivated and entertained throughout your session. With Yesoul, workouts are entertaining, fun, and effective. Considering a home exercise bike but deterred by Peloton's $2,500 price tag and additional 24 monthly subscription, that is more than I paid for my first car. The Yesoul G1MPlus offers a comparable experience for a fraction of the cost, saving you over $2,000 on the bike alone. Enjoy free access to instructor-led workouts via the Yesoul app, eliminating the need for costly subscriptions. New Year, new deals. Kickstart your fitness journey with Yesoul's exclusive New Year offers. Use code NY100 at checkout to receive $100 off your purchase. Don't miss out on this opportunity to elevate your home workouts. Click in the link in the description down below to benefit from Yesoul's exclusive New Year offers. Workout does not feel like a drag anymore. Transform your fitness routine with Yesoul G1MPlus to make it a fun, effective, and enjoyable experience so that workout doesn't feel like a chore anymore. Experience the perfect blend of entertainment and exercise. Order now, take advantage of huge New Year savings, and start your journey to a healthier self. So frontal cranial area and ears. Have you noticed any discharge from your ears? Any? Wetness or abnormal?
A little bit of wetness that day and the day after, maybe for like a couple days actually, but that went away. But the pain is still there.
Any abnormal sound?
No, I mean, sometimes I have ringing in my ears, but that's already been an issue even before. But it's not too bad.
Okay. Any blurred vision or double vision, especially when you get the headache?
Sometimes a little bit when I get the headache, but not every time. That day, though, I was having a bit of blurry vision and my eyes were very dry, but it hasn't been too bad since then. I've been using some eye drops.
And do you happen to remember the outside temperature during those 2 weeks while you were?
It was like negative 25 to 30 Celsius most of the days.
So that's very cold. That's extreme cold. And you mentioned you were not wearing gloves.
And I was for most of the time, but then a couple of days when I got the frostbite, I actually lost them. So the last couple of days I wasn't wearing them.
How about the hat? Was your head completely exposed to the cold?
I had a hat on, but I guess it wasn't very thick.
And you also mentioned that your feet are impacted. How about your legs?
I think up until my knee, sometimes they get a little bit tingly and numb, but that's just sometimes like after a shower or after working out.
Okay. So feet and legs up to the knee area. Okay. Have you taken any medication or anything for the headache?
Sometimes I do take an Advil for my headache, but I try not to.
Has that helped?
It does. It doesn't make it go away completely, but it helps.
Does the pain wake you up at night?
Yes, and it's hard to fall asleep from it as well. I think it's worse in the morning, actually, is when it's at its worst.
Are you on any other medication?
No. I mean, I take vitamins and supplements, but no prescribed medication.
Just over the counter?
Yeah.
And how are your energy levels?
They have actually been pretty low ever since those last couple of days of the trip. I was there for a week.
Any other pain anywhere else in your body? Your back, your joint?
Well, sometimes my joints have this, like, sensation that they're really cold ever since that day. They're not in a whole lot of pain, and this doesn't happen every day, but it's like my bones are cold or something.
Have you heard any cracking sounds, any weird popping sounds when you just use your hands or your...
Oh, my hands, yes, but everywhere else it's okay, like not more than usual.
Have you had any difficulty breathing, feeling like you're, gasping for air or you can't catch your breath?
Actually, now that I think about it, when I work out, I've been at a loss for breath more than usual lately.
Right, so what I'm going to do today for you is a complete full body examination to make sure that I check out your skin and that neurologically, we're not dealing with something more than just skin exposure to cold. So I'm going to go ahead and do that today. Do you have any other concerns that I should know about?
Everything's been mostly fine, besides all those other things.
Okay, sounds good. So I'm going to go ahead and put my gloves. And I'll start by taking the vital signs to make sure that we have a good baseline.
Thank you.
And do you have a headache right now?
Yeah, but it's like around a 3 right now. It was really bad this morning, actually, but I took an Advil before I came here.
Good. So let's go ahead and just check your temperature. Have you had any flu-like symptoms in the last couple of days?
No, just besides the low energy, not really.
Okay, so no runny nose, no sneezing.
Mm-mm.
Let's go ahead and place this under your tongue, and you can just hold it. I'm also going to check your level of oxygenation and your heart rate through the index finger. So let's go ahead and rest that. Okay. 97.9, so normal temperature. And I'm reading 99% oxygenation and 60 beats per minute. So your heart is very relaxed. And I can tell that you're working out because you have a very low resting heart rate. So that's very good. So normal temperature and oxygenation within normal limits at room temperature. Good heart rate, and I'm going to go ahead and listen to your heart and your lungs. Go ahead and breathe normally. Go ahead and take a deep breath in and out. Deep breath in and out. Okay, good. You can just breathe normally. Switching to the bell side as well for the more superficial sounds. I'm hearing S1 and S2 with no extra hard sound. That's wonderful. So lungs were clear. You did not catch any pneumonia or anything more complicated.
Okay.
I was not able to hear any adventitious sounds or any wheezing in the lungs. So that's very good. And the heart sounds were normal as well. Okay, I'm gonna go ahead and check your blood pressure as well. Have you ever been diagnosed with low, high blood pressure before?
No.
Okay. Is it okay if we use this hand?
Yeah, of course.
Okay, so let me go ahead and match the artery right here. And you can just rest your hand and the legs are uncrossed. So blood pressure is a little bit on the low side. Are you feeling dizzy by any chance now?
I wouldn't say dizzy, but I am a little bit lightheaded.
Okay. I am 110/65. I would recommend that you increase a little bit your salt intake. Do you usually use salt in your diet?
I actually only started doing that a couple days ago.
Okay.
Because I read that I think I might be lacking some based on some of my symptoms, but I haven't been eating a whole lot of salt my whole life.
Yeah, and also sea salt. That would be very good to include in your diet, so that you get all of the minerals, not just the sodium, iodine-based table salt, but also sea salt that has more minerals might help increase that blood pressure a little bit.
Okay, thank you. I'll do that.
Okay, so I'm gonna go ahead and just inspect your appearance right now. And I'll be checking for anything abnormal on your skin, any redness. I can already tell that there are some spots that are a little bit red. Especially on your neck, over on the left side. Okay. The right cheek is a little bit redder than the left one, and same pattern is maintained on the neck as well, going to the chest, but the difference is not very big, so I'm not too concerned. Okay, I'll be looking at the inside of your arm as well. Good. Paying particular attention to any colors that are on the blue-purple spectrum, which I'm not seeing. The numbness is a little bit concerning, especially when there are no physical signs of intense frostbite. So do you feel this equally on both sides of the forehead?
I feel it a little bit more on the right side.
And do you feel this equally on both sides of the cheeks?
A little bit more equal there, but the right side is worse, especially closer to the ear.
And how about this?
It actually feels pretty okay there.
And this?
The same thing, the right side is more sensitive. And the same thing there as well.
Okay. I'm gonna go ahead and palpate your head. Check for any lumps, bumps. Any pain when I apply pressure?
Yeah, especially in the front.
Okay, on a scale of 1 to 10.
That was like a 6, 7, something like that.
How about when I apply pressure laterally? Any pain there?
It's more like a 2, 3, especially on the right side.
How about when I apply pressure
Oh,
on
it's actually really bad there. Like
the ears
an 8,
around?
yeah, 8.5.
I am sensing an inflammation over on the right side here. So the mastoid bone process is definitely impacted. Could be an infection, it could be a reaction to the cold. So let's go ahead and check your ears. First, I'm going to do a hearing test. So I have here a tuning fork, and I'm going to strike it and cause a vibration. And I will place it near your ear in 2 positions. And I want you to tell me which one is louder.
Okay.
So that's position 1. And position 2. Which one is louder?
1.
1? Okay, good. And now I want you to tell me when you stop hearing a sound.
Okay. No.
Good. Okay, now we're going to do the same thing on this side. That's position 1, position 2.
I kind of hear them both the same in that area.
Okay. And now tell me when you stop hearing a sound.
No.
Good. Okay. And now I'm going to strike the tuning fork again and place it on various parts of your body. And I want you to keep your eyes closed and just say yes when you feel it.
Okay.
I'm trying to detect how well you can sense the touch.
Yes.
Good.
Yes. Yes.
Good.
Yes. Yes. Yes.
Good.
Yes. Yes.
Good. And now can you feel this?
Yes.
Good. And this?
Yes.
This.
Yes.
All right. So let's go ahead and look inside the ear. And I'll be taking a peek inside your ear canal. And I want to see if I can spot any infection or any abnormal discharge, anything that would require us to put you on antibiotics.
Okay. Sounds good. Thank you.
You can look over to your left. I'm going to go ahead and just slide this inside the ear canal. Okay. I'm able to visualize the ear canal. I see the tympanic membrane, pearly gray color, a little bit of a discharge. And if I just go a little deeper, oh, yeah, I can definitely spot an infection. And I can see why your mastoid bone process is so inflamed. Yeah. Yeah, definitely I can tell that you have an ear infection going on, and the whole inner part of the ear canal has a lot of wetness and a lot of discharge. So I'm gonna go ahead and make a note of that. And we can definitely put you on antibiotics.
Thank you.
I'm going to prescribe 750 milligrams of amoxicillin that I want you to take twice a day, so once every 12 hours
Okay.
for 7 days. Okay. And let's go ahead and look in the other ear as well, just to compare, and so that I have a good baseline for the other ear. early grade tympanic membrane. Bony landmarks are present. Whitish filament, well-defined margins, and no discharge. Good. This ear is clean. Okay, so that concludes the ear exam. We'll put you on antibiotics and clear that infection right out. I'm gonna go ahead and focus on your eyes. And first I'm going to check with the light. So I want you to look into the distance, and I'm gonna check for the pupil reflex. Good. 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 And I want you to look at me now, right here. Perfect. So no concerns with your eyes. Next up, I'm going to check your cranial nerves to make sure that neurologically everything is okay. So I'm going to push on you. I want you to kind of resist my push. I want to check how strong your back muscles and just your overall spine is. Okay, good, perfect. Now I want you to squeeze my hand. Good, perfect. And now I want you to keep your head steady and to just follow my fingers with your eyes on. Good. 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 Perfect. Okay. I'm also going to take a peek inside your optic nerve and optic disc and just make sure everything checks out over there. Okay. So go ahead and look into the distance for me. Going to get a clear picture of your eye first and calibrate my device. Perfect. Then I'm going to get really close and check the optic nerve and optic disc. Good. Now look into my ophthalmoscope device. Perfect, good. Now I'm going to do the same in the other eye. Look up for me, down, and now into my device. Perfect. So, eye exam is all good, no abnormal findings, good ratio on the optic nerve, no shadows, no scratches on the retina, and good mobility. So cranial nerves 4, 5, and 6 are okay. Can you move your head left to right for me? Any pain when you do that?
Yeah, when I moved my head to the right just now, I felt it like here. Some tingling.
Okay, I'm gonna do a neck inspection in a moment after I'm going to ask you to lay down.
Okay.
But before we do that, I am going to check your skin a little bit more.
Okay.
So I'm going to ask you to close your eyes, and I'm going to touch you with something that feels just very soft. And I want you to tell me if you feel it on your left side or your right side of the body.
Left. Right.
Okay, good.
Left. Right. Left.
Good.
Left. Right.
Next up, I'm going to give you something to taste. And we're going to make sure that cranial nerves are intact and that your sense of taste is not impaired.
Okay.
Go ahead and just, yep, and now close your mouth and open. Good. What does that taste like?
Like raspberry.
Good, perfect. So you're able to taste just fine. And I'm also going to give you something to smell. With both of your nostrils unobstructed.
No, it's like orange.
Good, perfect. And now I'm going to ask you to close one of your nostrils.
Okay.
And no. Smell this as well.
It's very chocolatey.
Perfect. So cranial nerves that control the sense of taste, touch, and smell are intact. Wonderful. I'd like you to lay down now so that I can take a look at your neck a little more and palpate, make sure that the lymph nodes are all okay, and then I'll check your abdomen, your legs, and your feet.
Okay, sounds good. Thank you.
Okay, I'm gonna go ahead and palpate your lymph nodes. And you can just close your eyes and relax. I'm gonna make sure that I'm not missing any inflammation signs that may have to do with how the fluid drains in your body. Okay, so I'm checking the pre-auricular and posterior auricular lymph nodes around your ear. And now the tonsillar lymph nodes and the submental. Good. Cervical. And we're on the right side, where I was able to notice most of the redness. This is where the mastoid bone process inflammation is also happening. I'm gonna go ahead and try to feel for any indentation in your skin. There is an overall inflammation. But it seems to be evenly distributed. With no micro indentations. Good. I'm going to check your sinuses as well. And I'll be gently tapping on your face. Let me know if you feel any pain.
No pain. A bit of pain there. A little bit of pain there as well. There too. Yeah, it's actually really bad there. It's a little less, but still there. Also some pain. It's getting less the further you go back. A little bit there. There too.
So it's mostly localized in the front area of the ear. Let's try to tap in the back of the ear as well.
Oh, it's really bad there.
Okay.
There too. There also. Not so bad there. My skin just feels a little weird there, but it's not too bad.
Do you feel this?
No.
How about this?
I felt a little bit, yeah.
Interesting. Do you feel that?
Yeah. Very light. I felt it closer to the top of my neck. There, I felt it, yeah. I felt it there too. I felt that also. And there. There too. I felt it there too. And that too.
Okay, do you feel this? And that? How about this?
No.
And this?
No.
This?
Yeah, I felt that. That too. Felt that. Felt that too. Felt that too. And that.
Okay. So you do have some loss of sensation, but it feels pretty just irregular. There's no obvious pattern, and it's spread out on the right side of the neck in just patches. So this could be because of frostbite. Do you feel this?
No, I heard it, but didn't feel it. I felt that, yeah.
Okay.
Didn't feel that.
Mm.
Didn't feel that either. Felt that.
Okay. So definitely the neck is affected. I'm gonna do just a deeper palpation in the neck. Supraclavicular lymph nodes are not enlarged. I'm looking for any masses or any indentations that are in the deeper parts of the skin. Nothing other than the inflammation here in the mastoid bone process. Okay, let's take a look at the abdomen next. Okay, Anastasia, I'm going to take a look at the abdomen. Is it okay if I lift your top just slightly? And then is it okay if I expose your belly button?
Yeah, of course.
I'll be doing a visual inspection first. It's part of the routine checkup just to make sure we're not missing any physical signs. So, standard basic clinical exam. Good. I'm going to go ahead and listen to your abdomen. So just breathe normally. Good. I'm hearing activity in all 4 quadrants. Some gurgling, which is within the normal range of activity in the abdominal area. Switching to the bell side for the superficial sounds. And again, rechecking the 4 quadrants. Good. I'm not hearing any signs of obstruction. I'm going to go ahead and feel the pulse, and that is in between the 5th and the 6th intercostal spaces. That's the pulse of maximum, the point of maximum impulse. 2, 3, 4. Good. So that's normal. I'm gonna go ahead and palpate your abdominal area. Checking for any hidden masses or abnormal enlargement of your internal organs. Checking the stomach. Good. Normal size. And the liver. Can you lift your leg slightly so that there's no tension in the muscle, and take a deep breath. And now exhale. Good. You can lower your leg now. The tip of the liver was barely palpable, and now I'm going to press down on your kidneys. Good. You have strong abdominal muscles. All right, perfect. I'm going to go ahead and take a couple of measurements. That's 30. Checking the overall proportions of your body. Next up, I'm going to check the skin on your abdomen, and I'll start off by just making sure there are no indentations or bumps inside the skin.
Okay.
So go ahead and relax. Nothing hidden underneath the skin. Okay. Are you able to feel this?
Mm-hmm.
Good. And now, can you tell me if you feel me touching you on the right side of your body or the left?
Okay. Right. Left. Right. Left. Left.
And how about now?
Right. Left. Right.
Perfect. Now I'll just be doing some tapping and percussion to make sure that the resonant sounds are okay too. Good. Nice and bass. Bass sounds are good. Similar resonance throughout the abdominal cavities. That's all quite normal. Okay, I'm gonna go ahead and check your legs next.
Thank you.
Okay, I'm gonna go ahead and take a look at your legs next. And I'll be doing just a visual inspection first. And trying to make sure there are no signs of frostbite. You have one bruise on your right leg. It looks a little bit bluish. Does it hurt?
Not anymore. That's from when I was standing up from my desk at work.
I'm gonna go ahead and percuss your legs and check for any pain.
And there's some pain at the bottom of the knee.
Right here?
Yeah.
How about here?
Yeah, there too. It's like dull.
So the kneecap is impacted. Palpating around it. Do you feel any pain here?
Not at the top, no.
So it's just the bottom. Okay. Do you feel this?
I feel it, yeah.
And this?
Mm-hmm.
This?
Mm-hmm. Mm-hmm.
Okay, and how about this?
Yeah, I feel it. I feel it less there toward the bottom of my leg, but I still feel it.
You feel that?
Mm-hmm.
Okay, do you feel this?
I feel it less on my foot and the bottom of my leg. I feel it more the higher you go up.
How about this?
It feels kind of tingly and weird up next to my toes. Yeah, it's like a weird, numbing, tingling sensation on my feet.
Okay, let me go ahead and take a look.
Yeah, it feels really tingly on my toes.
Do you feel me touching on your big toe?
No, actually.
Do you feel me pulling on your big toe towards your head?
I feel it like on the base of my toe.
On the base, but not at the top.
Mm-hmm.
Okay. So there may be some nerve damage towards the extremities and alongside the shin here. Definitely a neurological impact from cold exposure. Can you curl your toes around my finger? Not too much. Okay. They are very cold, so the blood flow must not be optimally flowing here. Okay. Do you feel this?
No. That I feel. I feel it, but it's like feels weird, kind of like tickly, tingly.
And this?
Same thing. Same thing there too. And that made a nerve sensation above my knee actually.
Oh,
Yeah.
okay. So you felt it here?
Like above my knee and my mid-thigh.
Okay.
I felt it like shoot up there.
Can you tell me if it happens again?
Yeah, it's the same thing.
Interesting. Okay, so definitely nerves are impacted. Okay, I'm gonna go ahead and check the plantar region of your feet as well.
Okay.
So we're definitely dealing with nerve damage on the right side of the foot and the leg here, and that is radiating up all the way towards your neck area, so the right area is mostly impacted. I'll go ahead and palpate the plantar region. Let me know if you feel any pain.
I feel some tenderness on the middle of my sole.
Right here?
Yeah, like at the middle, in the center. It's tender.
The feet are not swollen, but the right plantar region is more tender than the left. Okay? Just say yes when you feel me touching you.
Okay. Yes. 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 I felt it very subtly, less than the other. No, I don't really feel anything there. Yes.
Eight and 8. 3 and 3. 2, 2. expected symmetry is in place. Go ahead and push into my hands with your pad. Good. And now try to use just your toes to push into my fingers. So left one is good, right one impaired mobility and strength. Okay. Okay, Anastasia, this concludes the assessment for today. I was able to find some nerve damage, especially on the right side of your body, which is much more impacted from the cold than the left side. So I do want us to first take a CAT scan, right? And just make sure that there's nothing underneath the skin in the deeper layer of the tissue that's impacted from the frostbite. And then if that's not the case, then we'll just go through a dermatological treatment to just get your skin back to where it's supposed to be.
Okay, sounds good. Thank you.
I did prescribe you antibiotics for the ear infection.
Okay.
I sent those to your pharmacy.
Perfect.
And let's come back and see each other in about 2 weeks to see how your skin has progressed, and then review the results of the MRI.
Sounds good. Thank you.
Yeah, thank you as well. Good to see you.
You too.
Welcome back, Alexandra. I understand that you have some troubles with your abdominal area, so I'm going to be performing an abdominal assessment for you today. Tell me a little bit about what's going on with you.
Yeah, so I've been feeling a lot of pain in my abdomen for about 2 months now. About 2 months ago, I went on a beach trip with some friends, and I decided to get my belly button pierced. And I'm really concerned that something's going on there because of that, because they said the pain would only last about 2 weeks to a month tops, and now it's been 2 months, so I'm just concerned about what's going on.
Yeah, definitely a piercing should not be sore for more than a couple of weeks. So it's been 2 months and you're still feeling pain. On a scale of 1 to 10, how intense is the pain?
Honestly, it's about an 8.5.
Okay, so that is significant. Have you noticed any discharge coming out of the belly button?
No.
Okay. No discharge. Any redness?
Nothing noticed.
Okay. Is it more painful when you press down on your belly button or on your tummy?
No, definitely yes. I don't like any pressure on it.
Okay. Are you able to bend down and tie your shoelaces if you have to, or no, dress yourself?
I mean, yes, but it is painful because when I have to bend down, I do interact with it, so.
Okay. So you're generally trying to avoid that
Yes.
downward motion. Okay. Do you remember if the instruments that were used to penetrate the skin were sterile? Were they removed from a sterile pouch?
To be honest, looking back on it, I don't think it was sanitized that well. I just really want to get my belly button pierced, and I didn't really care about anything else. And I know that's stupid, but I think...
Yeah, no worries. It can happen, definitely. So you're not sure about the sterility of the instruments. Most likely, probably they were not disinfected. So there could be an infection going on. Okay, I made a note of that. Are you on any medication right now, Alexandra?
No.
No medication. Any allergies?
No.
Any pain anywhere else on your body? Your back, arms, legs?
No, it's just really there, only there.
Okay. Do you feel any tingling sensations or any numbness anywhere on your body, such as your arms, your chest, legs?
Yes, actually, which is kind of concerning. I feel some numbness on my lower abdomen, and then I have some tingles in my chest.
Okay.
So I don't know what that's from.
Do you feel like they radiate from the belly button area, or do they just happen independently from the...
I feel it does radiate.
Okay. So that's important to note down. So tingling in the chest. And then you mentioned the lower abdomen.
Mm-hmm.
Okay. Okay, let's go ahead and check out your dermatomes to begin with, to make sure that I perform a neurological assessment and that there's nothing going on that may indicate a disorder of your cranial nerves, and then I'll focus on your abdomen.
Okay, thank you.
Okay. I'm gonna go ahead and put my gloves on. And do you feel the pain right now?
Yes.
Okay. Let me just go ahead and palpate your abdomen around the belly button. So I'm not going to touch the belly button just yet. I just want to feel for any masses from this position. Okay. Sometimes the upper abdominal wall can be better felt when the patient is in the upright position. Okay. Good. So I'm not feeling anything. No masses felt in the upper abdominal wall. Okay. So let's go ahead and get your vital signs. Starting off with the temperature, 97.8. $99.4. Let me repeat that. $99.3. So you have a slight fever, not yet full-blown fever, but may indicate the beginning of an infection. Okay, let's check your oxygenation. I can rest that there. 99% oxygenation and 80 beats per minute. That's good. Let me check your pulse manually. Okay, good. Brachial pulse, checking for the character of the pulse. Good. and radially. Good. All right. I'm going to go ahead and listen to your heart. Go ahead and breathe normally. I'm also going to use the bell side. Good. I'm not hearing S1 or S2. The heart is strong, normal rhythm, about 80 beats per minute. Good. Take a deep breath in and out. Okay. Good. Deep breath in and out. Okay, can we breathe normally now? Good. So heart and lungs are normal. Normal oxygenation, 80 beats per minute heart rate, S1 and S2, present, S4, S5, absent. Okay. Go ahead and check your blood pressure. Go ahead and just relax. Good. 120/65, which is perfect. Next up, I'd also like to check your ears and your eyes. Starting with your ears. Have you noticed anything abnormal
Actually, yeah. My eyes have been a little watery, like more than normal.
Okay.
And then for my ears, they do feel a little off. I have been swimming, so it's probably because of that. But it's nothing too much of a concern, but definitely out of the norm.
Okay. So let's rule out any infection then.
Okay.
I'm gonna start by just palpating the mastate bone process behind your ear. And the preauricular lymph node. I'm not noting any swellness or anything abnormal. Okay, you can close your eyes. Yeah. And just relax. Okay. Right, let's take a look inside the ear. I'm gonna start with your right ear, so if you can look towards your left. Good, perfect. Gonna take a peek inside at the tympanic membrane, which I can clearly visualize. It is pearly gray, well-defined margins, bony landmarks are present. Just a small amount of wax buildup, but nothing concerning and no abnormal discharge. Okay, so this ear looks good. I'm going to take a look at this other one. Okay. Good. No signs of any infection. I'm gonna start with number 8. You can open your eyes now and look into the distance. I'm going to take a look at your optic disc and optic nerve. Perfect. Now I'm going to check for jaundice. Good. Check this other eye too for jaundice. Good. And check the optic disc on your left eye. Okay, looks normal. I'm going to start checking your cranial nerves. So I want you to keep your eyes closed and tell me if you hear a sound moving towards you or away from you.
Towards.
Okay.
Away. Towards. Towards. Away. Away.
And now do you hear the sound moving from left to right or from right to left?
Right to left. Left to right.
And now, is it going up or down?
It's going up. Down.
And now can you point to it? Good. I'm going to continue focusing on your cranial nerves. And I'm just going to begin by doing a palpation of your body to feel for anything abnormal. Any masses, any lumps or bumps, any changes in the temperature gradient. Temperature is normal, no lumps or bumps felt. I'm going to touch you with a slightly sharp object, and I want you to tell me if you feel it on the left side of your body or the right side.
Right. Left. Left. Right. Right. Left. Right. Right. Left.
Okay. Now I'm going to touch you with a wet or dry object.
Wet. Dry. Wet. Dry. Wet. Wet. Dry. Wet. Dry. 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 Wet. Dry. 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 Wet. Dry. Wet. Dry.
Next up, I'm going to touch with either a sharper object or a dull object.
Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. Dull. Sharp. Dull. Sharp. Dull. Sharp. 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 Dull. Dull. Sharp. Dull. Sharp.
Alexandra, let's lay down and take a look at your abdomen. Okay, Alexandra. So I'm going to take a look at your abdominal area. Is it okay if I unbutton your pants and lift your top?
Mm-hmm.
Okay. See the belly button here, a little bit of redness around the top of the piercing area. I'm gonna go ahead and begin by just visually inspecting. Okay. Looking at how the skin is reacting to a uniform small amount of pressure. Go ahead and take a closer look at the belly button under normal light. I am seeing a little bit of an inflammation underneath the piercing. There is redness present at the side. A little bit of discharge. There is definitely an infection emerging. Yeah. Okay. So we're definitely going to treat you with antibiotics. I'm gonna go ahead and prep the area so that I can take a sample. Sanitizing. Applying the reactant. Around the location. And then applying the reactant at the incision site. removing a little bit of the discharge and placing it in the container. Making sure that I remove enough of sample here for the lab analysis to get a good reading. And now cleaning the area. I'm also going to apply disinfectant. Gonna let that sit for a good 30 seconds and then I'll remove the bandage. Okay. So we're gonna actually not apply any other bandage over the area because we want it to breathe and we want the air to make contact with the moist surface and dry out the infection. Okay. I'm also going to test the sensitivity on your abdomen. So this is dull and this is sharp. So I want you to say dull or sharp. Dull. Sorry. You're asleep. It's okay. I'm happy I was able to put you to sleep. Okay. Oh my gosh. Okay. Dull. Sharp. Dull. Sharp. Sharp. Dull. Dull. Sharp. Okay. And now I'm going to touch you with one or two sharp P-point here. Is it one or two? One, two. One, two. Two. Good. Two. One, two. One, two. 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 The redness has decreased, and I can see the belly button is not as inflamed as before. Let's leave it to air out. Let's check it again in a few weeks. No more than 2 though. So we have an appointment for a medical examination today. What brings you in?
I've been feeling a little under the weather. I have a sore throat, and I feel a little bit weaker this past week. When I walk up the stairs, I feel shortness of breath. I feel like my ears are a little clogged. It's just all over. I feel a little foggy, honestly. I don't feel like myself.
Okay, well, I'll be more than happy to do a medical examination on you today. And it is the cold and flu season, so you probably caught something. Okay, so when did the symptoms begin for you, Alexandra?
They started around Monday.
Monday of this week.
Yes.
Okay, so 5 days ago. And have you experienced any body aches?
Yeah, my lower back area. Sometimes, even just standing, it hurts. I do feel a bit more achy than usual. Yeah, mostly the tension's back there.
Have you had any fever?
Yes, no, I've had, the last 2 days my fever was a bit high, so I've just been laying down. I haven't really been doing much.
Okay, so you've had fever the past 2 days. Okay. Do you know what your temperature was when you had fever?
It was about 99.8.
99.8. Okay, any shortness of breath?
Yes. I've been having that all week, but mostly walking up the stairs. I've had to take my time, just because I just feel so lethargic, and I just feel weak. So I definitely have shortness of breath.
Runny nose?
Yes, not right now, but that's also been a symptom.
Sore throat?
Yeah, definitely. I can feel it so much right now. I just keep drinking tea. I keep drinking soup. Mostly I just need something to help with soothing my throat because it's so bad.
On a scale of 1 to 10, how bad is your sore throat right now?
I say an 8.
Okay. So I've definitely seen a lot of cases of strep as well, so I'll take a look. Any problems with your vision? Double vision, blurred vision?
Yes, I have had blurred vision.
Okay.
It's been a bit of a problem. I've had to drive a little bit, so I've had to make sure I was able to, and it's been honestly a bit uncomfortable. It's been a little better, but still it comes and goes, and yeah.
Do you wear contacts or glasses?
No.
No. And when is the last time you had an eye exam done?
Last year.
Last year, okay. And as far as you know, your vision is 20/20?
Yes.
Okay, so there should be no reason why, you should be experiencing those. Okay. They may be associated with the cold and flu symptoms that you mentioned. And you mentioned some back aches, and I'll definitely take a look at your back and check your spine mobility. Any joint pains, such as, the joints in your feet, your hands, your shoulders?
Yes. I feel like my knees have been a bit more weak. I don't know why. In my shoulders, yeah, there's been some pain. So I've been using the heating pad. Honestly, I've just been achy all over, but mostly those areas.
Okay. So knees and shoulders. I'll definitely make sure to check those out. Have you had any injuries lately?
No.
No injuries, okay. How about your skin? Any rashes, any irritation, itchiness?
There's been some redness on my chest. I'm not sure right now if it's visible, but I have been noticing that, and I have been putting ice on it to make it go down, but I don't know. It just comes and goes. And then my face has been a little bit more red. My whole body's just been acting up all week.
So face and chest. And has anything helped? Have you tried it?
No, not really.
And the shortness of breath and difficulty breathing that you mentioned, has that been happening on and on, or all throughout?
Honestly, it's been all throughout.
Okay.
Like, even just walking to the kitchen, like, I just feel like I need to take my time doing that. Like, it's such a simple task, and I'm young, and I feel like even that's been hard this whole week.
All right. Do you have any known allergies?
No.
Are you taking any medications right now?
No.
Okay. All right. Do you know if hyper or hypotension runs in the family?
Not that I know of.
Not that you know. Okay, sounds good. So let's go ahead and check you out. I think I got a lot of information here, and I'll do a very thorough investigation, and I'll focus on your cardiovascular system, your lungs, your heart, your blood flow and circulation, and we'll see what could be the cause of the symptoms that you mentioned. But I do suspect either cold or flu, since we're in that season.
Gotcha. Okay, thank you.
Okay, I'm gonna set this aside here. I'm gonna put on some medical gloves. Are you in any pain right now?
I do feel uncomfortable in my sore throat. It's not going away. So that's mostly where the pain is. And I do feel achy, but I wouldn't say it's too bad. It's just mostly my throat.
So you would say that you feel the most pain in your throat now?
Mm-hmm.
Okay.
And I have this, I feel like sometimes I like cough. I just want to I don't know, it's a whole thing.
Okay, so just backed up.
Yeah.
Okay. So I'm gonna go ahead and start by just doing a visual inspection of your body. I'm going to check for any redness, any rashes, any irritation, dermatitis. Sometimes viral infections specifically can manifest themselves through the skin as well. So I'm gonna go ahead and just inspect you. Just take a look. Just going to look at the scalp in the front and the sides. Sometimes we can have redness, irritation that starts at the scalp area, since it's very sensitive. Okay. So I'm not seeing anything out of the norm. And your chest is not red, not reddish. Not seeing any colors that pop out. I'm going to look inside your arm as well, since sometimes we can have psoriasis, dermatitis hiding in the inner portion of the arm. Okay, over here. Palms are not red. Checking the capillary refills. 2 seconds. So circulation is normal. Okay, that looks good. And let me see the inside of your palm as well. Checking the circulation in your right hand. Within 2 seconds, good. Okay, and okay, so I'm not noting any abnormalities with your skin. I'm gonna go ahead and palpate your head and your lymph nodes and your arms and just make sure I don't feel any bumps, any lumps, any congestions, especially with your sinuses. So let me know if you feel any pain. Okay, I'm gonna start my way from the top with your head. And you can just close your eyes and relax. And any soreness, let me know. Okay. So your head is symmetric. Checking for lumps and bumps now. Okay, not feeling any. I'm going to check your mastoid bone process behind your ear. Any pain there?
No.
Okay. And I'm going to check your lymph nodes. Okay. Preauricular and cervical occipital lymph nodes are barely palpable and mobile. Same with the supraclavicular lymph nodes. Okay. Checking your sinuses. Any pain there? All right. And the pectoral and auxiliary lymph nodes. Sometimes when we have viral infections, the lymph nodes are the first ones to react. I'm not feeling anything out of the ordinary. Good. All right, so I'm gonna go ahead and take your temperature and listen to your heart and your lungs. Check for any wheezing, any bronchitis signs, pneumonia signs. Okay, so let me take my basket here and let's start with just your temperature. Okay. 98.7. So right now you do not have a fever. When was the last time that you mentioned you noticed you have a fever?
Yesterday.
Okay, so yesterday. And right now, 98.7. So we are good for right now. Let's check your oxygenation as well. Please have your index finger. Okay, you can set this aside. And I'll just feel your pulse over on this other side while that reading takes place. So oxygenation is 99.8, so that's good. The heart rate is a little bit on the lower side, 70 beats per minute, and respirations were okay, about 15 respirations per minute. Are you an athlete by any chance?
I haven't really been in a while.
Okay.
Like in high school I was, but now I mainly do my walking and biking, but nothing more strenuous than that.
Okay, so let's check your blood pressure then. Since your heart rate was a little bit on the low side and you don't work out too intensely, so that can't explain it. All right. Have you been dizzy at all today?
Twice earlier when I got up really fast. Yeah, that happens usually when I get up.
But you haven't fainted or anything?
No, but I did have to like hold on to the chair to make sure I had balance. I did feel a little out of it, and my vision was blurry during that, but it didn't last long.
Okay. Can you do me a favor and hold that for me? And just lift your arm like that. So let's see if we're dealing with just a normal blood pressure or maybe a hypotension here. Given the low heart rate, so just go ahead and breathe normally. So a little bit on the low side. Okay. So try to open and close your fist like this one a couple of times to recirculate the blood, and lift your arm above your head. Okay, good. And do that 10 times. Okay. Good, and now let's take another reading. There we go. 4, 5, 6, 10. Now, a little bit on the lower side. And I'm gonna make a note of that. Are you feeling dizzy right now by any chance?
Not too much since I've been sitting down for a bit, but I feel as soon as I get up and I'm a little mobile, I might feel that again.
Okay, so 90 systolic, 60 dystolic. Okay, are you drinking enough water?
I guess I could be drinking more.
Yeah, definitely try to get in at least 6 to 8 glasses of water per day, so you keep your body hydrated, and that's going to carry water into your blood and keep circulation going and hydrate you. Okay, I'm going to set this aside, and I'm going to do an eye inspection. Can you look into the distance for me? Good, so pupils are round and reactive to light. Can you look up for me? I'm going to take a look at your conjunctiva. Okay. Pink and moist. Can you look down? Okay. Good, and now can you look at my nose? I'm going to check the consensual response. Direct, consensual, direct. Good, perfect. Okay, and next up I'm going to take a look at your ears and then your nose and your mouth. Okay. Alright, let's just inspect them. Can you look towards your left? Good. Have you noticed any discharge, anything abnormal with your ears?
No.
Good, so ear oracles look healthy to me. I'm not seeing any external discharge. I'm going to take a look inside your ear canal with my otoscope here. Okay, and you mentioned a little bit of stuffiness and pressure. Is
Mostly this ear.
mostly that ear. Okay. So let me go ahead and look inside this one first. If you can look over to your left. Okay. A little bit of wax build up in the normal amount. Tympanic membrane looks healthy, well-defined margins, pearly gray color. Bony landmarks are present. The light cone is present. Okay, so not seeing any signs of any infection here. Let's take a look here. Okay, does this hurt?
No.
How about when I pull up?
No.
Laterally?
No.
Okay, let me take a look inside. Just gonna come close. Okay, a little bit of a redness, slight beginning of what could look like an infection. Yes. Okay. Any pain in this ear right now?
No, not too much. It just feels a little blocked, I don't know how to describe it. Just a little uncomfortable, but nothing crazy.
Yeah, tympanic membrane looks okay, well-defined margins, expected color, but I'm seeing a little bit of a redness and what looks like the beginning of an ear infection. So we'll put you on some antibiotics to deal with it.
All right, thank you.
Okay, so I'm going to make a note of that. Left ear, inflammation noted, redness and slight yellowish discharge. Okay, so I'm going to prescribe you an antibiotics. We'll put you on some amoxicillin, which is a broad spectrum antibiotic, and that should clear it right up.
Thank you.
Okay, so next up I'd like to take some measurements, and I'm looking for any asymmetry, any inflammation I may have missed just by visually inspecting you. Okay, so I'm going to begin by measuring the crown of your head. So we are at 22. Okay. Across the shoulders at 9. Okay, over your arms. Okay, 6. Okay. Just going to take a note of that. Okay. I'm going to check your reflexes next, and that's just going to provide me with just a general view of your neurological state. So I'll be tapping you with my medical hammer and let me know if you feel any pain or discomfort. Okay, I'm going to start with your jaws. If you can just open your mouth a little slightly. That's too much, a little lower. Perfect. Okay. Good. All right. Good. Good. And just relax your arm. Good. Perfect. Okay. Any pain here?
No.
Good. All right, so reflexes check out. No major neurological red flag. Right, let's take a look at your nose. So you mentioned that you did not have a runny nose, or have you had a runny nose?
I did have it earlier in the week.
Earlier in the week, but not right now. Okay, can you look up for me? I'm just going to check for any obstruction. Okay, not seeing anything, so I'm just going to palpate your nose and your sinuses inside here, ethmoid and sphenoid sinuses. You can just close your eyes. Okay. Any pain here? Alright. And let's take a look inside your mouth. Okay. You can stick out your tongue for me and open up and say, ah. Yeah, definitely an inflammation in the back of your throat there. Can you lift up your tongue? Touch the roof of your mouth. Okay. Okay. Yeah, so I'm definitely seeing a very red sore throat. Sore throat. And I'm also seeing a couple of little pockets of whiteness, so that is indicative of strep. Early stage, there are not too many of them, but definitely something is brewing over there. So the amoxicillin that I gave you for the ear should help clear the throat as well. Okay. Okay. Wonderful. Definitely make sure to take the full course of antibiotics. I'm going to prescribe you a full 7-day course.
Okay.
Even if you start feeling better, do finish all of them.
Thank you.
All of the doses.
Good.
All right. Next up, I'm going to listen to your heart and lungs. So you can just close your eyes and then relax. Heart sounds healthy, no murmurs. Go ahead and take a deep breath in and out. Okay, deep breath in and out. Deep breath in and out. Okay, good. Now breathe normally. Okay, I'm also going to listen to the pace of your lungs right here. Yeah. Hearing a little bit of wheezing, Alexandra. A little bit of wheezing in your lungs. Definitely, based on the symptoms, you are fighting some infection. Okay. Not too bad though. Alright, next up I'm going to just test your dermatomes on your chest and on your face to just rule out any other neurological disorders. So we're going to go ahead and do a test that's called sharp or dull. Maybe some have your palm. Okay, so this is dull and this is sharp. Feel the difference? Yes. Okay, close your eyes and tell me if you feel sharp or dull. You can lower your hand. Okay.
Sharp. Dull. Sharp.
Alright.
Dull. Sharp. Dull.
Alright. Now I want you to tell me when you stop feeling the dullness. So just say now. Okay. Okay. Good. And do you feel this?
Yes.
Equally on both sides of your forehead. B1 is clear. Do you feel that? Equally on both sides.
Yes.
B2 is clear. And do you feel that?
Yes.
Equally on both sides.
Yes.
Good. V3 is clear. And do you feel that?
Yes. Yes.
That.
Yes. Yes. Yes.
Good. Alright, let's go ahead and lie down so I can take a look at your abdomen.
Okay.
Alright, Alexandra, are you nice and comfy? Alright. So I can go ahead and just relax. I'm going to focus on your abdominal area. And is it okay if I lower your jeans a little bit?
Mm-hmm.
Okay, can I unbutton them?
Yes. Oh.
Sorry. Okay. Alright. Oh, how long have you had the belly button ring for?
For about 9 years.
Okay. So it looks like it's in wonderful condition. No signs of any infection or inflammation. Alright, I'm gonna go ahead and just inspect your abdomen first. I'm going to listen to your tummy and check for abdominal cavity activity. Have you had any breakfast this morning?
Mm-hmm.
Okay. I'm definitely hearing activity equally distributed within the 4 quadrants of the abdominal cavity. So that's good. The sounds are clear sounds, no signs of any obstructions. Okay. So that's all quite normal. I'm gonna set my stethoscope right here. Okay, now I'm gonna go ahead and first do tapping and check the resonance of the sounds that come from your abdominal area. Okay. Checking for dullness and uniformity all throughout. Okay, good. Good level of resonance. Perfect. So I do like those sounds. Right, next up I'm going to go ahead and palpate and feel for any lumps, any bumps, any masses that shouldn't be there. Focusing on your liver first. And the tip of the liver is barely palpable, but I do feel it. And liver is not enlarged. Okay. Right ovary, left ovary, no pain. Stomach is not enlarged. Spleen the same. Kidneys are okay too. Okay. I'll go ahead and just measure your abdomen here. So, checking for symmetry again. That looks good. 30 across. Good. I'm looking for any asymmetry of your, now the proportion of your torso relative to the measurements that we took of your head. Good. 69. 69 and a half. Okay. Any pain when I press down on your belly button? Okay. All right. So I'm going to close you up here and let's take a look at your knees and your feet and your legs. Okay, so I'm going to check out your knees. And I'm going to just palpate first and check the patella, the tibia bone, and the cartilage. Okay. I'm not feeling any signs of inflammation, no masses hidden. Cartilage is mobile. Alright, I'm gonna do a little tapping on your knees, check for any abnormal pain. Okay. I'm also going to take a couple of measurements, check for symmetry. And can you lift your leg a little bit? across is, okay, we are at 35. Okay, and now lift this one up a little bit. 34. Okay, I can lower them now. Alright. So knees look good. Is it okay if I remove your socks?
Mm-hmm.
Gonna set that one down. Okay. I'm going to do a visual inspection of your leg and your feet. Put my glasses on for this. Okay. Not seeing any redness, no obvious signs of any inflammation. I'm going to check the pedal pulse first. 2+, synchronized. Okay. Good. Pedal pulses are okay. Taking a look at your nails and in between the toes. Can you curl your toes around my fingers? Perfect. And now wiggle your toes for me. Good. Okay, checking the capillary refills. 2+ on all of your toes, so good circulation. Toes are a little bit cold, but even temperature all throughout. Okay. I'm going to attempt to spread your legs apart. Don't let me do that. Good. Now I'm going to attempt to bring them together. Don't let me do that. Perfect. And now push into my palm with your toes. Good. Right, flip over so I can take a look at the plantar region of your legs. And can you wiggle your toes from this position? Good. No obvious calluses, no redness, a little bit of skin peeling, but that's normal given that it's winter and so dry outside. Okay. I'm going to palpate the plantar region of your feet. Starting with the calcaneus region. So no tenderness, no pain is noted. I'm not feeling any deformities. The arc of the foot looks good. Okay, do you feel this? Mm-hmm. And this?
Mm-hmm.
Which one was sharp? Left or right?
Left.
Okay. Is this sharp or dull? Okay, again?
Dull.
Okay.
Dull. Sharp. Sharp. Dull. 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 Sharp.
Okay. And is this hot or cold?
Cold.
Okay. Do you feel this?
Yes.
And this?
Yes.
And this?
Yes.
And this?
Yes.
Okay, I want you to tell me when you stop feeling this sensation.
No.
Okay.
No.
Good.
No. 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 No.
Excellent. And do you feel this?
Yes.
And this?
Yes.
Good. Okay. Any pain there? No. Any pain there?
No.
All right. Let's take a look at your back next. Right, Alexandra, is it okay if I remove your hair? And I'll just tuck it to the side. Actually, I'll just tie it in a ponytail. So I have hair tie right here. And is it okay if I unhook your top to expose your spine? Okay. Just tuck those right there. Well, inside. Alright. So I'm just going to feel the temperature of your back first. Evenly distributed. Going to check your spine. Can you bend your head forward a little bit? Yes. Okay. Feeling a little bit of a deviation right here. Okay, can come to the center. Just a slight deviation in the curvature of the spine here. Okay. Thoracic and lumbar spine is straight. And now I'm checking for any nodules in between the vertebrae. Okay, head down one more time. Okay. And you can come back to the center. Okay. Good. 39, 40. Just checking the ratios. 40 over 37. Good. Okay. I'm also going to listen to your back, your lungs. Take a deep breath in and out. Deep breath in and out. Okay, now we're going to do something called whispered pectoraloquy. So go ahead and whisper 1, 2, 3 whenever I touch you with my stethoscope.
1, 2, 3.
Okay. One more time.
1, 2, 3.
Good.
1, 2, 3.
Good.
1, 2, 3.
Good. So I'm barely able to hear you through the stethoscope, so the resonance is just as expected. All right. Now I'm going to check the sensitivity on the dermatomes right around your spine area. So I'm going to touch it with a slightly cold object, and I'm just checking for any abnormal reactions. Okay, good. And do you feel this?
Mm-hmm.
And this?
Mm-hmm.
Okay. So back exam checks out. No positive findings. I'm going to go ahead and close your top and we can discuss the results. Okay, Alexandra, this concludes the exam. I did a neurological assessment, a cardiovascular assessment, full body examination. I could find a little bit of an infection starting in your ear and what looks like strep in the back of your throat. And I have here a prescription for you for amoxicillin. So take that once every 12 hours, one dosage, 10 mLs for 7 days. Other than that, let's monitor how you're feeling, and I'd like to see you back in a week or so and reassess you.
Thank you.
Welcome back, Juliana.
Thank you.
So I heard that you had an accident and something is going on with your knee.
Yeah, I was longboarding and I fell. And I fell onto my knees and also kind of sprained my ankle. And I also fell on top of the longboards, like here. Okay. So here also I have pain, and then down my knees and foot.
Okay, so left knee and foot and the left side of your abdomen.
Yes.
Okay. How long ago did this happen?
A week ago.
1 week. Did you hit your head when you fell?
No.
On a scale of 1 to 10, how intense was the pain right after the fall?
Right after was like 5.
Okay.
Right now I would say it's a 3 or 4. When I exercise, it's worse.
Okay. And the longboard, you said that it hit you right here.
Yeah.
Okay,
I fell onto it.
Was there any penetration of the skin or?
No.
Okay. I'm not able to see a bruise, but it does feel like the area here is very swollen a little bit.
Mm-hmm. And it's very tender when you press it.
Okay, let me just compare with this side. So it's definitely hard here. And a little softer here. So you might have an internal bruising. Okay. Any pain when I press down?
A little bit.
Are you on any new medication?
No.
Did you lose consciousness when you fell?
No.
That's good. Any other symptoms with your eyes, your ears? Oh,
No.
okay, good.
And I've taken like a muscle relaxant to help with the pain to sleep.
That's good. And did it help?
Yes.
Did you take anything last night before you came in to see me?
No.
No, good. So no ibuprofen or Tylenol, nothing for the pain. Good, so I should be able to observe exactly what's going on without interference from any other medication. Good. Any flu-like symptoms?
No.
Okay. Are you able to elevate your leg at all? Okay, that's good.
It hurts a little bit.
So, restricted mobility. Okay. Can you uncross them and cross the other leg over? Okay, now can you go back? Okay, that's good. Let me go ahead and put my gloves on. And I'll begin by doing a visual inspection of your abdomen and your knee from this position. And how long ago did you get the tattoo?
Probably 10 years.
Yeah, it looks like it healed just perfectly. Okay. So let me just go ahead and take a look first. Okay, I'm feeling for any inflammation first. And I am able to see a couple of scars here, but they look pretty old, right?
Mm-hmm.
Okay. Let's see. Any pain here?
A little bit.
Okay. So let me go ahead and check for any crepitus. And we're going to go up one time and then down. Okay. Down. Okay, good. I'm not able to hear any clicking sounds or anything that might indicate an actual tear of the meniscus. Not seeing any bruising or any rashes or irritation on the skin. Okay, gonna go ahead and tap very lightly on the kneecap right here and around it, and I want you to tell me if you feel pain.
Yes.
Okay, right here?
Yes.
Okay. On a scale of 1 to 10, how intense was that?
4.
A 4. How about right here?
Yes.
And here?
No.
Okay, so right here.
Yes.
Okay, let me go ahead and take a look at your abdomen too. Any pain there?
No. 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 Yes.
No. Okay. How about here?
Yes.
Okay, you can come back up now. Yeah, I understand. So you have pain right here, and then right under the meniscus, more so on the median zone than the lateral one. Okay, let me just quickly listen to your heart and lungs to make sure that I'm not missing anything obvious. Okay, just go ahead and breathe normally. I'm able to hear S1 and S2, not hearing any extra sounds. Okay, take a deep breath in and out. Good, I'm just assessing your lungs now. Good, you can breathe normally. Okay, going to check your aortic pulse. Good. And I'm going to check for any bruits around your carotid artery. Good. And I'm going to take your pulse manually. Good. Gonna check your brachial pulse and radial. Okay, very well. Can you squeeze my hand? Good. Can you bend forward? Good, and then bend back. Perfect. Can you go like this? Okay. Does this hurt right here?
A little bit.
Okay. You can lower your arm. Okay. So lungs and heart exam was a pass. No bruits were heard. Abdomen is swollen and slightly distended on the lower left side. Okay. No obvious breakage of the meniscus. Okay. Can you keep your eyes closed and let me know when you stop feeling a touch?
Stops.
Okay.
Stops. Stops. Stops.
Okay. And
Stopped.
good.
Stopped. 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 Stopped.
Good. Okay. Checking the proportions. 34. 30. Okay. That is symmetric. You feel a little warm to the touch. Have you noticed a fever in the last couple of days?
No.
No. Okay, let me go ahead and check your temperature. 98.9. That's good. And may I please have your index finger? Okay, let's leave that for a second. So no fever and upper body dermatomes are intact. Abdominal dermatomes are intact. 99% oxygenation and 80 beats per minute. That is within normal parameters. Okay, let's go ahead and lay down and I'll take a closer look at your abdomen and your knee. Okay. Okay, let's do a couple of range of motion so that I can understand exactly the extent of the damage here. Can you elevate this leg? Okay, now lower it. Now can you do it on your own? Okay. And how about the left arm? Okay. And any pain right there?
No.
How about here?
A little bit.
Okay. Let me go ahead and focus on the abdomen first. Is it okay if I elevate your top and lower your pants?
Yes.
Okay. gonna go ahead and palpate the area. Checking for symmetry around your abdominal cavity. And checking for any masses. Okay, can you elevate this foot a little bit? And yes, you can like that, and just rest it there. Good. So that the muscles are not tightened. Okay, good. I'm not able to feel anything abnormal. I'm gonna go ahead and clean the area. Okay, I'm going to check the dermatomes on your abdomen. I caused a vibration. Go ahead and tell me when you stop feeling it.
Stop.
Okay, good.
Stop. 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 Stop.
Good. Go ahead and tell me if you feel this on the left side of your abdomen or the right one.
Left. Right. Left. 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 Right.
Okay, good. And now I'm going to touch you with 1 or 2 prongs. Go ahead and say 1 or 2.
2. 1. 2. 1. 1. 2.
Good. Now I'm going to touch you with something sharp or dull.
Dull. Sharp. Dull. 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 Sharp. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull.
First up, it's going to be something wet or cold. Wet. Cold. Cold. Wet. Cold. 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 Wet. 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 Okay. You have a slight elevation of the skin on the left side. The elasticity and the pinch test. Okay. Checking the right foot for any signs of edema. As well as the left. The left kneecap is definitely more swollen. Comparing it to the right one. A little bit of an inflammation right here. And checking the tibia bone. Can you tell me if you feel a sensation on your right foot or the left one?
Left.
Good.
Right.
Good. Now can you tell me when you stop feeling it?
Stopped.
Good.
Stopped. Stopped.
Good.
Stopped.
Okay. Can you push with your pads into my hand? Perfect. I'm gonna do an inspection of your toes. No signs of clubbing or pinning on the right foot. Gonna check the left one. These toes are a little more reddish than these ones. Yeah, I think you have a slight inflammation going on with your toes. Okay. Going to feel the plantar region. Okay. Right foot is normal. Any pain there?
No.
Okay. Can you bring your big toe toward your head? Perfect. Now try again. Perfect. And now point towards me. Okay, reduce mobility on this one. Okay. Can you tell me if you feel me touching you on your right foot or your left?
Left.
Okay.
Right.
Okay. Now I want you to flip face down so I can take a look at your calves and your ankles. I'm going to palpate your calves. No signs of any edema. And measure your ankles. Okay. They are very symmetric, so I'm not feeling any swellness or seeing any asymmetry with your calves. Okay, can you tell me if this is sharp or dull?
Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp.
No nodules behind the skin. And no abnormal reactions on the bottom plantar region. Okay, am I touching you on your left or right foot?
Left,
Good.
right, left, right, right, left.
Good. Okay. Can you curl your toes around my fingers? Okay. Let's try from this position. Perfect. And now squeeze as hard as you can. Good. And now let's try the right foot as well. Perfect. Okay. Okay. I'm going to do the Babinski test. Good. Perfect. So now positive findings. You can go ahead and stand up and we can discuss the result. Okay, Juliana, so I did a very thorough investigation. The good news is that there's nothing neurologically wrong with you. Most likely you just bruised your kneecap and your foot and the paddle board that kind of pierced you right here created a bruise internally in the abdominal cavity, but that should subside within the next couple of days. So
Okay.
if you don't start feeling any better, then come back and see me.
Okay, thank you so much.
You're welcome.